Walk into any community center on a Tuesday morning, and you will see a masterclass in controlled chaos. A dedicated social worker meets a new client who needs immediate help, starting a race against the clock to deliver critical services. But the moment that client sits down for intake, their personal history scatters. The cohesive story of a human being in need is instantly sliced apart and fed into a dozen different tracking methods. A medical consent form gets printed and locked in a physical filing cabinet, while daily program attendance is tallied separately on a paper clipboard. Meanwhile, the volunteer shifts required to run the program and the mandatory staff compliance records live in totally isolated software applications. None of these systems talk to the client's file. Because the data is walled off, the social worker is forced to operate partially blind. They cannot see the complete, overlapping needs of the person sitting right across from them. This structural friction places a heavy administrative tax on highly trained professionals. Instead of focusing entirely on casework, empathetic staff are forced to act as data entry clerks. The continuous cycle of tracking down files and manually cross-referencing information consumes an estimated 15 hours of staff time every single week. That is nearly 2 full workdays stolen from direct community impact. When mission-driven work is buried under repetitive, redundant paperwork, morale drops rapidly. This exact friction is a primary driver of chronic staff burnout and elevated turnover rates across the human services sector. Compassion and dedication are no longer enough to sustain an agency. The sheer weight of disorganized information actively threatens a nonprofit's operational capacity and long-term survival. That threat peaks at the end of the month. To keep their doors open, nonprofits rely on private grants and government funding, and those funders demand rigorous, data-driven proof that programs are actually working. Staff face the intense pressure of compiling complex demographic details, specifically social determinants of health, which track vital economic and housing stability markers, pulling them one by one from outdated, disconnected databases. Building a single compliant grant report becomes a frantic exercise in comparing volunteer hours against scattered attendance logs, hoping the numbers match up. An agency can do life-saving work in the community, but if they cannot empirically prove those outcomes to grantmakers due to missing or messy records, they risk losing the capital required to operate. Here lies the central operational dilemma. Mid-sized human services agencies operate on strict budgets. They do not have the hundreds of thousands of dollars or the dedicated IT departments required to deploy complex commercial enterprise software. Attempting to solve this by stitching together cheap, standalone apps for forms, scheduling, and chat only makes the problem worse. It creates new, digitized silos. The solution is an unbroken, synchronized data layer, an architecture where program attendance, staff credentials, and client intake all live securely in exactly one place. True sustainability means abandoning the patchwork of isolated tools and adopting a holistic ecosystem where every piece of data updates instantly across the entire organization. This is the exact architecture provided by Hibox for nonprofits, an integrated, cloud-based operations platform purpose-built to act as a central command center for human services agencies. Hibox handles complex client intake natively. Its specialized form builder captures sensitive demographic variables and risk factors immediately at the point of entry, formatting the data perfectly for federal reporting requirements. The system automatically tracks volunteer shifts and translates those logged hours into quantifiable monetary value. This gives agencies instant financial leverage for grants that require matched funds, requiring zero manual math. For the staff, an integrated learning management system passively monitors mandatory certifications. It assigns required courses and sends automated alerts before credentials expire, maintaining constant regulatory readiness. Operating at the intersection of healthcare and education, the platform maintains strict compliance with federal privacy frameworks like HIPAA and FERPA, securing the personal information of vulnerable populations with encrypted, role-based access. By absorbing these heavy administrative burdens into a single synchronized database, the software restores the critical time and energy that staff need to focus directly on the people they serve. For executive leadership, this architecture provides a complete, real-time dashboard of organizational health. Directors can spot bottlenecks immediately and manage cases proactively, ensuring no one slips through the cracks. With longitudinal outcomes and pre- and post-assessments perfectly linked to individual profiles, agencies can generate pristine, funder-ready reports instantaneously. This concrete proof of efficacy directly multiplies an organization's ability to win and renew competitive grants, securing their long-term mission. Replacing operational chaos with a unified system protects dedicated staff from burning out and guarantees that beneficiaries receive highly coordinated, holistic care. Reclaiming thousands of hours of lost time translates directly into expanded community impact. Start your free trial or schedule a demo today at hibox.co.